All right, fantastic. Let's get a start on. Anyone that wants to join, we'll let them in. Great. So hi everyone. I'm Amon. I'm the president of BIMA. Thank you everyone for joining us today. So how it's going to work? We're going to have a talk by our speaker today, followed by a Q&A. Please, if you've got any questions, do put in the chat. So just to start off, I would like to introduce Ash Soni, our Imperial College graduate who went to the USA to practice plastic surgery. This was at the Johns Hopkins University and the University of Washington. Then he came back to London to do an amazing fellowship in microvascular surgery and now runs his own private clinic, the Soni Clinic. So I'd like to introduce Ash Soni.
Thanks so much, Anna, and thank you so much to the Society for having me on today to speak. It really is an honor to speak to so many of you in this chat room today. So my name's Ash. I'm just going to share a screen just for my introduction slides, and this is really going to be largely a talk that's not with slides. I'm just going to show you my introduction. So this talk is just really my journey from from the UK to the US. I'm becoming a plastic and reconstructive surgeon, training in the US and going from medical school in the UK. I'm just going to touch on a few topics. Obviously, my personal journey today, why I chose the US in the first place, the US versus the UK, the advantage and disadvantage of both systems, and really the question, would I do it all again? And I think that's probably the question that I'm sure a lot of you are wondering. So just to kind of give the background, my name is Ash Soni. For any of you who have any questions after the talk, I can share in the chat box later my Instagram handle, but it's at the Soni Clinic. And you can always DM me or message me anytime after this talk for any questions. And I'll be doing a Q&A session at the end of this as well. So really just a few points, really a comparison of the two systems and kind of my journey. So, I was born and brought up down in Surrey. I then ended up going to Imperial College, London for medical school. I had an amazing time there, and kind of pretty early on there, I started to ask myself the question of where I saw myself and whether the UK versus the US, and I wasn't really sure at that time. And then my brother actually leaped over there, leapt over. He went over to the States to practice law. And for me, that was my first, wow, I've got a family member out there, maybe I should start thinking about it. So, and I'd always been interested, quite honestly. I'd gone to America a lot as a kid. And so what I did was I started to do some electives and some observerships out there in my summer holidays. So from as early on as actually fourth year in Imperial, I started to go out there, spend a few weeks doing some experiences with a urologist, with a couple of bariatric surgeons, with kind of different specialties that I'd not covered a lot of in med school in the UK, and also to kind of just see what the system was like and what it was all about. And I think when I got to my elective in my fifth year at Imperial, I opted to spend that whole time in America doing two placements. So I did one at Cornell in New York City, in urology. I was pretty interested in urology at the time. It was something that I'd not really had that much exposure to. So I wanted to see what it was all about. And I think from the perspective of training, I realized there that they seem to work a lot harder, but they seem to have a lot of autonomy. I mean, the juniors were operating a lot. The kind of consultant was running two theaters at the same time, and the trainees were really getting so actively involved. So it was something that I started to consider a bit more seriously as time went on. And, the time then, I started to ask myself the question, well, if I want to do this, then how am I going to get into the system? And about the USMLE exams and really the overall path. And I think from my perspective, it was intimidating, right? It's daunting to do something that you don't know, a system that you're completely unfamiliar with. And I think on top of it, I had really no one to turn to. I mean, I didn't know anyone from Imperial who had done it. There was one person who lectured us who was like a medicine resident in California, but he already had a green card. He was married to an American. His situation was completely different to mine. And I think being a foreign graduate without a visa or a green card, I think the questions then start coming into my head, how am I going to do this? And so I love that I can give back now to all of you guys, but I definitely didn't have anyone at that time to turn to. So I started to read a lot. I read some books. I started to see what the application process would really, truly involve. So I initially started with thinking about when I was going to sit the step exams, and I made Because I think by that point I realized that, wow, you know, this system, there seems to be a lot of from respectable med schools. Imperial College finals are no joke. They're really, really challenging. For any of you who are about to sit them, good luck. But I remember them, you know, they were tough, and I wanted to fully focus and devote my attention to that rather than try and learn the American exam material. So as soon as I finished finals, I rejected my F1 job. I actually had my #1 deanery. I was, you know, really happy, but I didn't rank the jobs. I just got the deanery, and it gave me enough confidence to say, you know what, if I go back through the system and the American thing fails for me, I'll just come back to the UK and do my F1. So I made a conscious decision not to do my F1, and we can address them. I'm sure there'll be some questions about whether or not one should do an F1. You guys can ask me that later and we can address it. But for me, I I've graduated from med school, and then I started to study for my exams. And I basically gave myself 7 months to do all the steps. So I did step 1, step 2, CK, which is the clinical knowledge written exam, and then the clinical skills exam, which was the in-person step 2 exam. And step 1 was challenging. That's all the basic biochem, you know, DNA, RNA, transcription, translation, like all the stuff that I hadn't read in 6 years. And I think for me, that was the most challenging, because to go back to some of that material, I hadn't covered that since first year or second year of Imperial. So it was a challenge, but I signed up to a couple of online courses, and I was basically studying like 13, 14 hours a day for it. I mean, I was just, and I got, you know, all my studying, I booked the exam 2.5, 3 months after, and I just committed. And I did that, and then I did my step 2 exams. And during that time, you know, once I started to, I was applying for research fellowship positions during that time, those few months while I was studying. And so I literally just, you know, emailed around a ton of people around the US, like at top institutions in the surgical specialty that I wanted to do. And I think for me, I knew that from what I'd heard, applying for plastic surgery was impossible, is what I was told. I met a couple of New York plastic surgeons along the way, and they had told me, listen, no matter how good you are as a foreign graduate, you're never going to match. It's not going to happen. Like, even if you spend 2-3 years with us in the lab, we still can guarantee we could like give you the position. So I didn't want to risk it, and I just went for general surgery and thought I could always do a plastic surgery fellowship and end up being a plastic surgeon. It would just take me a bit longer. So I did my research. I applied for research in general surgery, in specifically metabolic surgery, so bariatric surgery, but in order, you know, for the remission of type 2 diabetes. So they were doing gastric bypasses and sleeve gastrectomies, and seeing the effects that it had on the metabolic syndrome. And for me, I was applying. I applied across the country, interviewed at a few places, and decided on Cornell. So I went to Cornell's hospital in New York City, the New York Presbyterian Hospital, which is on the Upper East Side. And it was an incredible year for me. And the reason why I wanted research in the US, I think it was important to get some publications at a top institution there. And while doing that research, I can apply for the match. And I think it would give me a letter of recommendation from a top US place. And it shows that you're obviously committed to the US system, that you're doing research there. And it was really just filling the time that I was going through the match process in America with the most productive way I could think of. And so I published a lot during that year. I was lucky. There was a lot of opportunity for book chapters and papers, and, you know, a load of things, to be honest. And I think that's important. And I did have a few publications from med school, and then combined with my research in the US, I think that helped me with my application when I applied for general surgery residency. And so I applied, and I matched at Johns Hopkins for general surgery, which for me was like more than a dream. I mean, that's like, that was the #1 hospital for general surgery. And so that for me was like more than I ever thought I could even possibly achieve in the States. And it was incredible. Like, it was an incredible feeling. And when I started Johns Hopkins, I realized, man, the system is brutal. the hours, the work. I mean, it was a brutal life. I think what I realized was I'd never got up that early in my life before. You know, I was waking up at like 2:45 in the morning to get into hospital for 3:30, for rounds to start at like 4:30. I mean, it was madness, and I'd never experienced that in London. I'd never experienced that in the UK ever. And I was there till like 9 o'clock, 10 o'clock at night every single day. So it was like 3:30 to 9, 3:30 to 10, like every day, 6 days a week, guaranteed. You had one day off, which was Sunday. But in my first year, and that was a tough experience. But it was also an incredible experience. I worked with some amazing people at Hopkins. I operated, you know, an incredible amount. But I think what I realized is I had to work very, very hard at the very beginning and scrub into like every case I could possibly do, because I don't think technical skills are taught as well in the UK as the US medical students are taught. I don't think suturing, knot tying, all these basic principles. And you know, I'm probably going to start some courses at some point around London, UK for that, because I don't think it's taught well enough. But that was something that I really had to work on to make sure that I was, you know, really, really proficient. And I did, you know, I think for me, I was then looking for plastics jobs, and because the Hopkins position for me was a preliminary position where they offer you a 2-year job essentially, and they do that for foreign graduates in any top place for surgery. It's really impossible to get a full 5-6 year program straight up as a foreign graduate with no experience with no clinical experience in the US. And but it's you know, it's a chance to prove yourself, to get into the system, and to get letters really early on. I mean, I needed letters of recommendation within 2-3 months of my intern year, which is my first year, and that's a big thing. And you need to work harder than any American graduate. You need to be better than any of them, because you'll have no shot otherwise. And then I applied for my plastic surgery position, which opened up over in Seattle, and again, it was a top 5 program in the US, and I ended up getting the one spot. So I was extremely grateful. I think it's something that my path was pretty streamlined in that I went a straight run through, but it's not always that way. And I don't want that to be the message, the takeaway message today. I think the takeaway message should be that you have to have patience. It's a game of patience. It's a game of dedication, and it's a patience of real hard work. So I guess if you know, I guess the next question should be, and I've talked about a little bit now about my journey of how I ended up becoming you know, a plastic surgeon. So I graduated from Seattle after my training. I moved back to London. I've spent over a year at the Royal Marsden doing microvascular cancer reconstruction. And I've set up my own private practice as well, called the Soni Clinic, which is based down in Surrey and Berkshire. And how did I get here? You know, like, and why did I choose to go to the US? Like, that's probably the biggest question that some people say. Why the US? For me, it was like I talked about already, the challenge that I really wanted to challenge. I wanted to challenge myself and prove that something that people told me was impossible was possible. Just to prove that I was able to do it for myself, and also America was a place that, because of all the experience I'd had out doing electives and observerships when I was in med school, I think that prompted the idea of the US. And when I look back, I think the main reasons were, yeah, I wanted a challenge, but also the autonomy that the trainees get out there is pretty amazing. I mean, you get to operate a ton. You know, I logged thousands of cases in my training, and you get a lot of independence and autonomy, which is amazing. The case volume and variety is huge, especially if you're at a big academic trauma center. For me, I was at one of the top academic trauma centers, which was the busiest in the Northwest of America. So we were covering basically a third of North America's volume. Everything was airlifted. It made my trauma on-calls absolutely brutal, because I was operating day and night all weekend when I was on call, which was horrific. But again, your experience is broadened. You feel very confident coming out, and you feel you can really take on the most complex of cases independently. So I think from that perspective, those are kind of the main reasons what prompted me to go to America in the first place. If I talk about really now the advantages and disadvantages, well, we talked about the advantages, but what are the disadvantages of America? I think if you guys had asked me maybe 2 or 3 years ago, my opinion may have been slightly different. I may have been like, wow, America's amazing and training's amazing. But I think as you go through the 6-year training program, you know, and doing 100 to 110 hours a week, you realize that there's no balance, there's no work-life balance, there's no time to see your family or your friends or really have much of a life outside of the hospital. And I think, you know, you've really got to have an understanding partner if you're in a relationship or you're married, and you know, I'm married and my wife was super understanding, but that's not always the way. And I think it's hard, especially if they're not in medicine, to truly understand that. I was lucky, but I think these are things to consider. You know, I had to give up all my hobbies basically for 6 years. I really just didn't have time for anything. And so I think that was the toughest part. I think that, you know, the other thing as well is that the work culture can be quite toxic depending on what institution you are. And I think in America overall, they're workaholics. The UK has definitely more balance than the US. And after working in London and having a lot of friends in the UK system, I know for a fact that they don't work anywhere close to 110 hours a week. And, you know, there were times where I was on call for 72 to 100 hours, and I was on day and night, and I was up day and night without any sleep for 3 days or 4 days and nights, operating on hand trauma or face trauma. And I think, yes, you get a lot of experience, and yes, you get a lot of cases, and you feel, you know, that you have that independence, but it comes at a cost. And people all the time say to me in the UK, well, you did training in 6 years, like here it takes so much longer. And I'm like, yeah, but it also comes at a big price. It's not just 6 years of training and that's the way, you know, pulling those kind of hours and those shifts. I mean, that's unheard of. And that's also very unhealthy. Like a lot of my colleagues were having marital problems and going through divorces and going through mental health issues. And of course they would, because it's a brutal system that is unforgiving. I mean, I had to miss weddings, I had to miss funerals, I had to miss everything. There's just no room for your life, and no one really cared that much about what was going on with you. And that was the hardest part for me. I think that brought me back to the UK, and we can talk about that in more detail. I'm sure people are going to ask me why I came back. There were many factors for me, but that was one of the biggest reasons, is that I think the work culture in America is pretty toxic and malignant. And I think if you're going to work in a culture like that for years on end, it's a tough system to spend your life in. I think when we talk about, I know that, you know, obviously this is for the Indian Society, and I think that one of the questions I got asked by the team was to kind of talk about my experiences being Indian in the system within the UK and the US. And I think, you know, in the UK, especially being Imperial and in London, you know, it's a very culturally diverse city, as many of you I'm sure are aware of. And I think that really makes a pretty enjoyable experience. But I definitely experienced racism more in America. I did my training, like most of my training, in Seattle, which is actually a very liberal, progressive city, but definitely not as culturally diverse in the hospital. And I definitely experienced my fair share of racism from patients in A&E or in the trauma bays, and I think that was really from, the majority of those patients were probably from the middle of the state, and I think when Trump came into power, that definitely affected it. So I think I just wanted to touch on that subject. I think I'm sure there are parts of England or parts around the world where you would experience racism being of a different ethnicity, and I did definitely more in America than the UK, but that's just something I wanted to touch on, just given the fact that this was an Indian Society talk. I think in terms of then I guess the next section that I'd want to briefly mention is, what are the most important factors to consider when you're applying? And especially for those of you who are considering America or a competitive job, even if it's in the UK, I think one of the most important things that I can give, the tips that I can give you guys. So I think first and foremost is research. I think no matter what kind of practice you want to end up doing, whether you want to end up going into private practice or not, or an academic job, I think we all have to be academically inclined throughout our career. You're never really going to progress if you're not. I would say research is imperative, and do that early on as you can. So for any of those who are in medical school, who are like midway through or even early on, if you're interested in surgery or medicine or psychiatry or whatever you're interested in, get somebody who you can look up to, who's a mentor to you, who can help you through it, whether it be a senior reg, a senior fellow, a consultant. But get involved early, get involved in research, get yourself on some papers, like this stuff will help you, especially with your applications when one day when you're applying for a core surgical job or a plastics job, whether it be in America or the UK. I think that get extracurricular activities, get leadership activities, be president of societies, be VPs of societies, play sports for the unis, whatever you can do to show, I did some volunteer experiences throughout my time working in hospices or working in, nursing care homes or just volunteering somewhere. You want these experiences under your belt. It really does show. And it's not just for the CV. I mean, you should want to do that anyway, just from a compassion standpoint. But even if you're more inclined towards like doing it for your CV, whatever reason that gets you there, I would do some volunteering, and extracurriculars should not be underestimated. Those are the points that get brought up in interviews and get brought up on people's applications that I think generally speaking, UK medical students are a bit laid back about that. They don't emphasize that as much as, for example, the US graduates. So that's something that I would consider. Obviously, your exam scores and your scores during your rotations, your grades during rotations do count. They will be looked at if you apply to America. People will see whether you've got honors or not. Whether you've done well in terms of grades wise. Obviously, distinctions help in medical school, but I mean, again, that's something that can just be written in your CV if you did obtain them. So I think obviously from an academic standpoint, if you were applying on the USMLE scores are obviously extremely important. But I think don't underestimate the power of your CV, the power of research, and the power of extracurricular activities. You want to show you're an all-rounded individual who's been working towards this for many years. So definitely I can't emphasize that enough. I think academics and grades are fine, and that we all need that, but the rest of it is equally important. And then I'm gonna leave the floor open soon for as many questions, because the majority of my talks that I do and the webinars that I do are a lot of Q&A driven, and I do want to interact with you guys and hear what you guys have to say and all the questions. I will address everyone's question today. But I guess the last few minutes, I just want to kind of touch on, was it all worth it? And I'm sure people are thinking he's back in the UK, and he, did this crazy move to America. Was it all worth it? I think it's a difficult one for me to answer, to say, yes, it was. I don't have, I definitely don't have regrets in the process. I think it was an amazing experience where I felt like I became an extremely confident, independent surgeon when I graduated training in the US. I think that was in part because we just had so much independence. There was just so much volume at my center that, there was no fighting with trainees competing for cases and things, which I saw quite a lot when I was in medical school in London many years ago. So I think from that perspective, it is amazing. And I think the opportunities that are out there, even the job opportunities afterwards are great. I mean, I was approached by some really amazing jobs in some top cities in America, but I decided that I wanted to come back home, I think for a number of reasons. One was family, which was a big one for me, as well as obtaining more of a work-life balance. I think that was a key thing, and I think there's ways to be successful in either country. So I would say that, from my perspective, you've got to weigh up obviously all the various factors involved in the process, and say, where could you see yourself ending up. And I actually thought I'd end up in America for good. I didn't know I would come back here for good to the UK. But I think, you know, the reality is that it's a very tough world out there. It's a very tough system. It's not to say that you can't manage it, or you can't deal with it. I think we can deal with whatever we put our minds to. But burnout is a real thing. I think I never really believed in burnout. I wrote a post on it on my Instagram like a couple of weeks ago, which you guys, I can send you the Instagram handle for you to check out the post. But the post I do for foreign graduates is kind of based on every experience that I've had. And I think burnout, I really did feel it by the end. I mean, I think when you're surrounded by such toxic people and working like such crazy hours, it hits you all at the end. And I think we never really take the time during med school or training or whatever stage we're at to really kind of just, we're always focusing on the next goal and the next task, and it kind of keeps us going constantly. But sometimes you have to take a minute just to reflect and say, like, what are we doing? You know, what are we doing? Like, reflect on the present, I think, sometimes as well, and what you, and how far you've got to get to that stage, rather than continually focusing on the future goals. So I think I would love to take as many questions as you guys have about the process. You can start typing them in the chat box now, and I will go one by one and answer all of your questions. But that's kind of my personal journey. I could talk for a long time about this, about kind of, you know, whether it's worth making the leap and everything. But I think overall, you have to ask yourself, you have to have a really good, you have to have motivation to do that and have really good reasons for wanting to go over. It's definitely not smooth sailing. It's not a chance to leave the UK system because the UK system is longer than the US. Like, there's advantages and disadvantages to every system, but the UK isn't all bad. I think you have to just weigh up. You have to have really good reasons and a good driver, because it's a lot, and you need something to keep you going and motivated. So I really thank you for being patient and listening to me for the last 35 minutes. I know it's a lot of chat, but hopefully I can answer a lot of questions now. Please just type away, and I'll go through the questions one by one. So let's see in the chat. So the first question was, I'd really love to go to Canada. Could you speak about the process to go there and what it's like to practice there? Is it as hard to get to the Canada as an international graduate? That's an interesting question. I don't know the Canadian system as well, although I would say that the Canadian system recognized the UK system more than the US. So from limited knowledge and from people I've spoken to, I think the Canadian system is actually a slightly easier system to get into than the US, but I would definitely speak to people who've done it. Obviously, to get into subspecialties in Canada is obviously very, very tough. I think they just recognize the UK kind of umbrella a little bit more, but I would try and get in touch with somebody who's done it, because I'm not sure about that in enough detail. Next question. I have heard similar experiences as yours in residency, but I've also heard that it gets better. Is that something you'd agree with? Yeah, it can do. You know, as a consultant in America, my life would be better than it was as a resident, for sure. But if you're in an academic center and you're doing trauma, you're still expected to go in for your case in the middle of the night. You're still expected to do all the admin. You're still expected to go to conferences. So we used to have conferences 3 days a week at 6 a.m. Or later 6:30 a.m., which means that even as a consultant, you have to be there at 3 of those conferences at 6 a.m. every week. So I know that from speaking to my consultants that when I was in training, they did say to me that it becomes a bit of a burden after a while to be constantly, you know, doing all the administrative stuff that comes with an academic institution. I think if you went into private practice and you had like an easier life, then yes, you could have a great life and you could make good money and you could have a good work-life balance. But you have to bear in mind that the culture overall in America is a lot more like dog eat dog, a lot more competitive. People are out there ripping each other apart and not really supporting each other all the time. So I think you're in a brutal world, and even in private practice, people are ruthless. And so, yeah, you can say the same for some of the people in London as well. But I think overall, generally speaking, that it is a bit more of a tougher world out there from all of my experience. Next question, USMLE is becoming pass-fail in 2022. As a first-year medical student, I'm torn between the importance of having a great score, but not taking the test too early as I'm only in the first year. What would you advise? Good question. I would advise you to wait until you feel comfortable to take the exam. So I'd wait until your second year, at the end of your second year, to do that. The pass-fail is going to be like this for everyone going forward. So I think what I stressed about the importance of all the other factors on your CV, like research and all your extracurricular activities and your USMLE Step 2, those are the things that are going to differentiate you. So your Step 2 score is going to be really important, but they're only doing that for Step 1. So I would just wait until you're comfortable to do it. Don't rush into it, and because if you don't get a great score and you rush into it, that's worse. Because you really need, especially if you're going for anything competitive, you need a super top score. I mean, I would say anything above 245 is probably to be expected for any competitive specialty like plastics. Did you apply for research fellowship after completing all the USMLE steps or before? I applied for the research fellowship before I completed my steps, but I was going through the steps while I was interviewing. Doesn't matter. Most research fellowships, they don't all need USMLEs to do the fellowship. So find out if they do and they require any of the USMLEs by that point. It's not a big deal. I would just apply to the ones that don't require USMLEs to do the research. Thank you, Dr. Soni, for the incredible talk. You're welcome. Thank you so much. Do you think the lack of work-life balance in the US system is something that's found in all medical specialties or just specific to surgery? Great question. I think overall, the work-life balance in the US system is much worse than the UK system overall. And that's from having a lot of friends in medicine and, urology and psychiatry and all those things, because I think the hour limits in America are supposed to be 80 hours a week in residency. So that whether that be pediatrics or whether that be medicine or whether that be surgery, because the only difference with surgery is that the 80 hours gets like totally eliminated because you end up having to stay late because your cases run late and your theatre runs late. So I think it's definitely worse for surgery regarding hours and on calls, because my friends who do pediatrics and medicine, when they were on call, yeah, it's tough, but then when they finish call, they would clock out a bit more easily, whereas with surgery, you can't really do that. But I would say overall, the work-life balance is worse in America for everything. You mentioned spending time in the US observing surgeries while Imperial. How did you manage to get these opportunities? Email people, contact people. I used to email around, and without being too overly aggressive with your emails, just be delicate, but definitely show that you're keen, show that you're up for observing. And there's a lot of opportunities out there. You just need to contact people. And if people didn't reply, then eventually I would send a nice reminder email back a couple of weeks later. I did most of mine around the New York State. I found that the East Coast were a little bit more open to foreign graduates, but that's definitely something to bear in mind. You talk about the intensity of surgical training in the States. Do you know if the work-life balance hours is similar to medical specialties? We kind of went over that. Exactly like the previous question. It's still worse, but it's surgery is the worst, and depending on what surgical specialty, things like cardiothoracics, plastics for the trauma, neurosurgery, orthopedic trauma. Those are the things that really are the worst surgical specialties. So the worst specialties all around, actually. Thank you for such an insightful and balanced talk. I really enjoyed it. Thank you very much. I was wondering, did you have to academically excel? Yeah, you do. I mean, you definitely need to be top of your game. Like from the USMLE exams, you need top scores. From the research side of it, you need a lot of, as many papers as you can get. I mean, if you have less than 3 to 5, first author peer-reviewed publications, I would say that's too little. So you need a number of them. And I think for grades and exams, and I think distinctions in medical school probably helped me, like on my CV in certain ways. I'm sure they looked at that and said, okay, great. So yes, I think academically excelling is important, especially if you want to make the jump over to America. I think you've mentioned this before, but what would the root benefits, downfalls be if you're transferring to the US after foundation training in the NHS as compared to going when you did. It doesn't really make any difference whether you do your foundation training in the NHS or not. I would say, from my perspective, it's not needed to do the foundation year training. Like, if you wanted to come back to the UK, you would just redo that training anyway. And if you came after you've done all of your training in the US, then it doesn't really make, you know, you'd get a full license with the GMC anyway, because they would have to verify your training with a lot of scrutiny to make sure that you've met all the criteria to have a full license here. So I think overall, it doesn't really make any difference. Having foundation training won't really benefit you. It won't help you get the job, because if you do clinical years in a country outside of the US, they're not really that bothered, unfortunately. It's just the nature of the system. So it's really up to you. If you want the foundation training, either for financially or for your own passion, then do it. Do you have any thoughts about the UK MLA rolling out in 2024? I'm not sure what the UK MLA is. If you could just specify in the message, that would be great. As a first year, I don't really get opportunities to meet consultants, so we don't have placements. How would we go about getting research experience? Be proactive. I know that you don't get a lot of clinical involvement, so it's harder because it gets a bit easier when you're a third year. But if there's something that you're interested in doing research in, I would make that opportunity. You know, arrange to meet one of the consultants in a field that you're interested in. People love having medical students getting involved in research, and I think it's underestimated. We're all a bit nervous, I think, when we're early on in med school, but I think you've got to be a bit more, you know, just be proactive, I think, and just email, contact them, maybe get in touch with their secretary or whatever, arrange to have a meeting, just say, you know, listen, I'm at XYZ medical school, and I'm really interested in getting involved in some research, and I promise you, consultants love key medical students, as long as you're not too aggressive. What are your views about the private healthcare system in America? Is it something that bothered you, especially coming from a country that prides itself on the fairness of the NHS? Listen, I mean, the NHS is an amazing thing, and I think we underestimate it. I think after being in America, and if you're a patient in America, you pay a lot of money for insurance. So I think it's difficult, because I think patients expect whatever they want when they want it. Like, they want the medications that they want the painkillers that they want. I mean, it's a very different system, and I think you have to get used to that, which was hard for me at the beginning and my bosses would just be like, listen, prescribe them what they want, you know, like, because they're all worried about getting sued or this or that. So I think it's a very different type of culture, but you get used to it working there. I think you just have to sometimes, I used to give patients advice just to help me sleep at night, and just say, like, you know, if I was you, blah, 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 like, in a really nice way. But, you know, sometimes you can't always get through it. Just kind of help know that I said the right thing. And then let's have a look. What's the next question? Realistically, have you ever heard of an IMG getting an orthopedic residency? Yeah, I have. And I think one of the for myself, getting into plastics is equally maybe a little bit more competitive, but ortho is super competitive too. I have heard of an IMG getting into ortho training. I actually helped them get, you know, with the application and with getting in and understanding the system a bit more. And they came from the UK too. It's difficult. I think going for any surgical subspecialty is difficult, but everything is possible. I think hopefully that's the point of my talk today, is that nothing is impossible. There's always a way to do it. You just have to really work hard. In the US, can you work in an academic institution and do private work? Yes, sometimes. It's hard. Some people have affiliations with academic institutions, but they're pretty much predominantly private. You can't do it quite like the way you can do it in the UK, where you have like 2 separate entities and each consultant works in both. It doesn't work quite that way, because the problem is the academic institutions will make you sign a contract where there's only certain amounts and certain things that you can and can't do. And the admin time and the time that you have to devote to the academic institution basically leaves you like with no other time to do private on the side. But it's hard for them, so it's a little bit more difficult. How do you apply for placements, observerships in the US at top institutions, and how early should you start applying? I would I think it's a little bit early until you get into your clinical years. I'd probably wait until you at least have some clinical experience, because there's no point in going over to America if you've like never done any clinical experience before. Yeah, so I would probably wait until you're like in your clinical year to start doing observerships and placements. Otherwise, you won't be able to really impress them with your, medical knowledge. So, but I would apply probably at least half a year in advance, maybe a bit more. And obviously, there would be unpaid observerships, but they're all good to have on a CV. Thanks for a great talk. Do you know what opportunities to do just research in the US, such as PhD programs and then coming back? I don't know a lot about that. I mean, people would be more than happy to accept you to do research in the US and then come back. It would definitely be easier than applying for residency. So I think it's something that you can look into, but there's a lot of research opportunities and a lot of PhD programs. Some UK programs have affiliations with US, and it's worth speaking to the consultants you work for if you're doing a PhD or you're interested in that, because I have a couple of friends who were trainees in the UK and their PhD supervisors in the UK were actually affiliated with a couple out in America, and they spent a year or so doing research in America. So there is definitely ways around it. What do you think makes a great surgeon, and what keeps you motivated during the hard times? That is an excellent question. To make a great surgeon, I think firstly it involves the key things that got you into medical school. So dedication, determination, your work ethic. I think the practice makes perfect mentality, or the perfectionist mentality can make people really good surgeons. I think if you are calm under pressure, that also helps massively, and don't get nervous or flustered in situations. I don't think you need to be great at art, or things that people say, oh, you need to be like really. I think you need to have like hand-eye coordination and good dexterity, but a lot of those skills people learn over time as well. And I think what keeps you motivated in the hard times, you've got to really focus on your end goal. I think is you've got to see, really think about what's at the end of the tunnel for you, because I had a lot of hard times where I wasn't sure I was going to get through it or wanted to get through it, being honest. And I think you've got to really focus on like the light at the end of the tunnel. And it's hard to see when you're early on in training and you have years ahead of you, and there's workplace bullying and there's all this kind of stuff that you have to deal with. But keep the end goal in sight. If you need motivation, you can always reach out to me as well, and I can help you. And I help a lot of students who kind of lack that motivation sometimes, and it's so easy. But I would just say keep going, focus on what you want and why you got into this in the first place. And I promise you, when you have your patients, doing these really cool surgeries, it's so rewarding, and that keeps you going. And that's doing those really gives you enough kind of happiness and motivation to continue. The next question: what is the process of moving from the US back to the UK upon becoming an attending consultant? They verify your training, so the GMC verifies all your training to make sure that you met the criteria, you get a full license. If you're in certain specialties, to get onto the specialist register is a bit more challenging. That's something that's worth, if you did know you wanted to come back to the UK after training in the US, that's something worth looking into early on. But you can definitely practice and get GMC registration without a problem if you've done good training and you've met all the criteria. If you could meet yourself as a first, second year medical student, what advice would you say about choosing a particular specialty? That's a great question. If I met myself as a first or second year medical student, I would ask myself what my interest in. Do I like anatomy? Do I like hands-ons? Am I a hands-on type individual? And again, that practice makes perfect mentality, I think, is applicable to surgery. If you're somebody who loves like the details of diagnoses, and when you get onto clinical rotations and you love the ward rounds and discussing clinical problems for like hours on end, like medics do, then that's probably a sure sign that medicine's more for you than surgery. But for me early on, it was pretty apparent that I loved like the technical aspect, working with my hands, like fixing problems with kind of your own creativity almost. And I think that for me kept me going, and that's what I would say. You've got to kind of, ask yourself early on. It's hard to do it as a first or second year medical student because you don't have any clinical experience, but definitely when you start getting into your third year, like really think about like, what do you enjoy? Like, and sometimes a lot of it's shaped by the mentors that you make and the people that you bond with. And I think that does shape our experiences in medical school, but definitely keep an open mind. For the full GMC license to practice in the UK, I've heard you need to complete at least FY1. How did you skip that year and come back? You don't need to do FY1. That's for the provisional registration, and it's like a myth that people always tell you. As long as they verify your training and make sure that it's equivalent to the training that you get in the UK, then you can get a GMC full license. Thank you for a very insightful talk. Understandably, success is subjective to each individual. How did your view of success change going over to the US and training there? That's a really good question. Success is subjective to each individual for sure. And I think for me, going over to the US was like a massive accomplishment. I never thought in the wildest dreams that I could do it. I didn't know I could get into training, and I certainly didn't think I could get into a place like Johns Hopkins to do general surgery. So for me, my definition of success changed in the sense that I realized, listen, people are out there to put us down all the time and to tell us that we can't do things and undermine us and say, you're not good enough, or it's too difficult. People can't do that. I don't believe in any of that anymore. You know, I used to listen to people who told me they can't do stuff and was like, you know what, I'm going to prove to them that I can do it. And I think success for me has been accomplishing goals that I never thought were possible, and also getting through a system that was like truly brutal, and the expectations set on you as a junior trainee was a lot there. So there was a lot of ways that I felt like, you know, I was successful in that sense. And I think now coming back to the UK and being able to set up my private practice and having my own patients, and that's another huge accomplishment for me. And it makes me realize that this was all worth it, this whole journey. What's the main differentiating factor apart from academics and extracurriculars? The interview process is a massive one. So yes, you need your CV, but your interview skills are the most important thing, because if you get the interview, in order to get that job, especially as a foreign graduate, you need to have top interview skills. And the same would apply if you're going for a competitive job in the UK. So work on your interview skills. That is like a huge thing. I actually have on my Instagram, I have a section about interview tips. I did a post about it fairly recently, and I'm going to be doing more about it. So definitely tune into the, feel free to log on to the Instagram and see what, I'll put it at the bottom. And I'm sure Emma can also type it out for everyone as well, just so that everyone has that. How much of the stuff covered in the USMLE do we learn in medical school? I would say the majority. If you go to a good medical school, the only thing that's different is like the units and some of the management protocols, but most of the stuff is covered. So if you go to a good medical school in the UK, you're going to be fine with the USMLE. Just work, do the question banks over and over again and again. I have sections about studying tips and stuff, so definitely check that out and message me if you have any questions about like what materials to use. What specialties do you think have a better scope in the US? Better scope in what sense? Do you mean easier for foreign graduates, or let me know what you mean by that. Would you be kind enough to share the surgeon's details, the orthopedic surgery? Yeah, I'll contact him to make sure he's fine with that. But I think the biggest thing, and we can talk about this if you can DM me on Instagram, but I would say that everything I tell you for plastics is totally relevant to orthopedics. In fact, I coached him through his application. He's a good friend of mine, and as long as you take all these points that we've mentioned and things that I post about, you're going to be absolutely fine. Is this recording going to be available anywhere because I missed the start? Yes, it's going to be recorded for you, and it will be posted. Do you have any advice for organizing a surgical elective? Yes, I would just email around, like we talked about for research. It's kind of similar. I would just email around different institutions and see who's willing to have you for a few weeks. I wouldn't do more than a month. That's definitely the most I would do for an elective. But find someone who's approachable, who's in the specialty that you want, and I think it would be good. Other than the USMLE score and research, what else is considered? We talked about the extracurriculars earlier, and then interviewing is a big thing, which we've also mentioned. Any advice for balancing studying for medical school and studying for USMLE side by side? That's something you have to figure out in terms of balancing. I personally left USMLE till the end, not to say that's the best way to do it, but use it in conjunction. You know, when you're doing topics, if you're in foundation years, like the year 1 and year 2 of medical school, and you're doing all the basics, then go through those topics in the USMLE question bank while you're doing it. It will definitely help you. So that's how I would do it. Did you take a full year out to do the US application process straight after graduating? I didn't take a year out. I took about 6-7 months to do all the steps. But in that time, I was interviewing for research fellowships, and then I started my research fellowship after 6 months, 7 months after graduating. So that's how I did it. Getting into Johns Hopkins is insanely awesome. Do you think any particular thing you did made you stand out and secure a place there? Thank you very much. Yeah, getting to Johns Hopkins was huge for me. I think my CV, my research in America, my letter of recommendation, and all the extracurriculars, my interview technique, I think all of these factors that I mentioned above will help you and stand out. Your personal statement is one that we haven't mentioned yet. I think it's good to have a captivating, something to draw them in your personal statement. But I think if you encompass everything that I've mentioned above, I think you're going to do great. If you don't get the placements in places like Johns Hopkins after your first application, what extra things would you add next time? I think try and get a preliminary position in a surgical specialty if you've applied for residency and don't get in the first time. I think just getting your foot through the door is helpful, or do a year of research. And I think research can often help you build contacts during that time. And it can help you, build a network for yourself. How do you feel about trading off specialty against location, i.e. going for an easier specialty? I couldn't do that because I didn't want to spend go to a nice city, but do a specialty that I didn't want to do. I mean, listen, this is your medical career. You're going to spend your whole life doing this practice. For me, I think a lot of foreign graduates would come to me and say, I would take pathology over surgery just to be in America. Coming from England, I don't really think, I honestly think it's important for you to do what you're passionate about rather than doing something just to be in America. You can't spend your life doing something that you're not passionate about. So that's my feelings on that. Amma, amazing Instagram person, keeps me motivated. Thank you so much. I'm glad that the Instagram can be helpful. Salaries for doctors in the US appears to be much higher than in the UK, although this may be because they work many more hours. The financial aspects of things is a question I get a lot. The one thing I would say is in training you get pretty much the same money. In fact, as a fellow now, when I was a fellow at the Marsden, you're getting more. You'll get more money as a fellow here in the UK than you do in America. However, as a consultant, there is the possibility. I mean, the average salary is definitely higher for a consultant, for sure, in an academic center. And it's pretty big difference if you're doing academic. If you do private, I think you can make good money in both UK and the US, but the US on average would be higher. So I think overall, but yes, your work hours, your work-life balance is much, much worse. Even as a consultant there, it's just something to be mindful about. It's something to really consider. But the money, obviously, people do talk about, but I would not go to America just for the sake of financial reward, because you can make good money here and have a much better pace of life. So that's something to consider. I've heard about people doing their year 6 elective in the US, but that you require the USMLE for this. There are a lot of electives that you can do that you do not need the USMLE for. I didn't do my USMLE then, and I know a lot of people who don't. Just find electives that you don't need it for. There's so many good ones out there. I wouldn't rush the USMLE just to have that. Let me know. Do you also share some content on Twitter? I don't. I share all of my content on Instagram. I will type my Instagram handle out for people to view. I just typed it out now so you guys can check out my handle. I do a lot of webinars and I'm doing like at least one post a week on things to do with foreign graduates, about burnout, about mental health and mental wellness. And I'm going to be doing a lot more going forward about educating people about not only getting to the US, but I think just really the life of a surgeon and a bit more of the reality. I like to paint as you can probably tell, I'm brutally honest with you guys, but I think it's helpful to have a realistic rather than for me to paint this like perfect picture of America and say like the American dream is possible. I think every system has its upsides and downsides, and I think you've just got to consider what's important to you. On that note, we're probably going to wrap up questions now.